ठीक है. Hi, good afternoon, everyone. Smriti. Good afternoon, everyone. Myself, Dr. Anshu Rana, Senior Consultant in Department of Obstetrics and Gynecology at Apollo Cradle Hospital, Greater Noida. So today I'm going to discuss about a very important and very common topic nowadays, and that is a polycystic ovarian disease. So you all must be heard this terminology, that is sometimes the people are coming Pcos, polycystic ovarian syndrome or disease, they both are same. And this is like a, nowadays we can see it's like a kind of epidemic kind of thing in our society because of this our lifestyle. So now this is a very important topic for as a general public awareness point of view, so we chose this topic to discuss in an open forum. So hope you all will be it will be helpful for you all. So for this, first of all, I just wanted to tell you about all this by this first slide. The option is in your hand how you want it to be look like. Obviously, all girls, all females want it to look like glamorous and beautiful with a good figure and everything. But for unfortunately, sometimes because of our that endocrinal imbalance in body, the few things are not under control of us, and how we can control it, that is also there, the option is also there. So the today's discussion topic is, so even if your things are not under control from the body point of view inside, but still the things you can manage from your side, how it will be. So today's discussion is going to be on that topic only. So first of all, I just wanted to tell you about what is PCOD, why this is important. One of the most common endocrine disorders in women and the most frequent cause of anovulatory infertility. And ovulatory terminology itself, you all must be understanding, means where the ovulation is not happen. So PCOS is strongly associated with insulin resistance, and insulin resistance put patient at risk of diabetes mellitus, cardiovascular diseases, hypertension, and the other another that endocrinal problems also. So now you can understand how important is the PCOD. So it affects the other organs also, although the patients usually come with the external problems or the menstrual irregularities, but it can involve the other system also. It can cause diabetes, it can cause cardiovascular problems, hypertension, and others. So, what is a prevalence? If you will go for theoretically, the prevalence is just 5 to 10% of the women of the reproductive age, but definitely the things are on higher side, especially in the Asian. Initially, it was more common in the Western. Now, because of the lifestyle and the whatever the food habits we are following, because of that reason, the prevalence is gradually increasing. So whatever the figure is here, 5 to 10%, that is maybe if I will just go for the all these personal individual data, it's much more than this incidence which is quoting in as a theoretically. So now I just wanted to tell you about what is PCOS. If as a layman, if you are not aware about any biological terminology and all, so how you will understand what is it is exactly. The name polycystic ovarian syndrome refers to the enlarged ovaries that contain many very small cysts. If we will simply we wanted to explain you, we can see the polycystic means the cystic. Poly means many, cystic means cyst, and in the ovary means multiple cyst in a ovary, and that causes multiple problems, which we are going to see in the next slides. What are the problems these can cause, and why it is so important to know what is the features, clinical features, and what are the other things which can happen because of these problems. So basically, first of all, going through in details of the polycystic ovarian disease, you must all be gone little bit in biology during your that school time, and you must be knowing how the menstrual cycle happens. So basically understanding your menstrual cycle is important at this point. For this I am not going to discuss all these slides because I can understand it's not easy to understand. You simply have to understand if somebody has a normal cycle, the cycle should be somewhere between the 25 to 45 days duration, and the amount of bleeding can vary from 2 days to 7 days. That is called a normal cycle period. If there is any variation in these things happening in form of either a shorter period or longer period, or amount of bleeding lesser or too much, that means you have to be little alert regarding your menstrual abnormalities. So basically how the PCOS presents, what are the symptoms by which you can think of, yes, I can have a PCOS and PCOD and I should consult my gynae. So the symptoms which is common, which is very common, is the infertility is one of the most common symptom. That is 75% cases can go for the infertility if somebody is facing going through the PCOD. Hyperandrogenism means abnormal hair growth in your body, that is also called as hirsutism. Amenorrhea, the lack of menses, means periods, you're not getting your periods. If you're even if you are getting your periods, it can be the delayed cycle, or it can be the prolonged gap between two periods, or sometimes in a small amount of bleeding, that is scanty flow or too much flow. So these can happen, but the most of the time it happens with the amenorrhea, means not getting your periods, that is 50%. And obesity is another one more common thing, which is 60 to 80%. As I said earlier, abnormal uterine bleeding, that is 30%. And even sometimes, even without any symptoms, the cycle is absolutely normal, but in the ultrasound finding, in the biochemical finding, we find the woman is going through the PCOD. So that's why the normal menstruation can happen in the as like a 20%, up to 20%. Even if the PCOD is going on, the menstruation cannot be disturbed. That can be the one of a situation which can happen. So you cannot level ki my cycles are regular, I'm absolutely getting a normal cycle, so I'm not going through. So in that situation, how then again your must be in your mind, the question must be going on, how we will know if my cycles are regular, then how I will know why. So now I'm going to come for that with another slides ki what are the other features of the PCOD. So before going in a details of that, well, a little bit I just wanted to tell you about what causes the PCOD. So causes of PCOS is not yet clearly known. So the most commonly thing which we find is the lifestyle changes. PCOS sometimes runs even in a families. If any of your relatives like a mother, aunt, sister, especially from the your mother's side, affected with the history of PCOS, there you are a more chance of getting a PCOS in you. The symptoms of PCOS are related to abnormal hormonal levels. Hormones are chemical messenger which control body functions, and the testosterone, one of a male hormone which is produced by the ovary. So women with PCOS have slightly higher than the normal levels of testosterone. So in you can understand in that way. So this is a male hormone which is also present in a female also. If there is imbalance of this hormone happens, so that ultimately leads to the PCOS. That's why the features like getting excessive hair or hair fall, these are the things which can happen with the PCOS system. So basically it's associated with many of the symptoms of the condition. If we will go for the another reasons, another most important reason is insulin is a hormone which regulates the level of your glucose, a type of sugar in the blood. If you have a PCOS, your body may not respond to the harmonic insulin, known as insulin resistance, so the level of glucose is higher. To prevent the glucose levels becoming higher, your body produces more insulin. So higher levels of insulin can lead to a weight gain, irregular periods, infertility, and higher level of testosterone ultimately, which I said earlier, and which can lead to the abnormal hair growth, hair fall, acne, in manner of all these symptoms. So now who incidence, if I will go for the incidence, as I said, the incident itself is not that much, but if we will go like nowadays, if I will say, the incidence itself is raising trend in society because of our lifestyle and all the food habits. The what are the symptoms of PCOS can include the irregular periods or no periods at all can be the one of the symptoms. Difficulty becoming a pregnant, as I said, the infertility is most common things. Having more facial hair or body hair than in usual, like which is called hirsutism in our language. Loss of hair on your head, like normally the your scalp is during your childbearing age, because it should be ideally with the effect of the estrogen and progesterone, the hair should be good. But here, as I said, because of the imbalance of the male hormones in your body, there may be the chances of hair loss from your scalp and the abnormal hairs on your skin. So these are the things which is not good for the women, which can happen: the loss of hair on your head, being overweight, rapid increase in weight, difficulty losing weight. Sometimes even the your cycles are regular, everything is there, but irrespective of your food habits, you keeps on gaining your weight. So that is one of another alarming sign when you should go to the meet a gynec, and you have to get you should get tested for the hormonal profile to know that is there either any kind of changes in hormone is happening inside the body, why I'm gaining weight irrespective of my diet and lifestyle. So these are the few things which you have to keep in your mind: oily skin, acne. Sometimes the woman doesn't have any kind of menstrual abnormalities, any kind of other features, but simply she has a lot of mood swings and depression. So these are another feature of PCOD, so you should visit. So basically whatever the symptoms I just not this you can see in a slide, and these are the features. If something is there going through you, you must visit gynae clinic, and you have to get tested for the features of the PCOD. Because why the choosing of today's topic is mainly because sometimes patients usually come in later part of a problem PCOD, where the treatment is more difficult, and for the patient herself, like suppose the patient is keen for a pregnancy, but she was not aware in about her PCOD earlier, because she was getting irregular periods. Only thing, she was little obese, higher side of weight, she has a mood swings, but she was not bothering about these problems, because she her periods was regular. As I said in my very first slide, the only the 20% of women can have a regular periods also. So it's not like that if your cycle is regular, everything is regular, and you have all these features, still you have to get tested for the PCOD. So you can see these are the by the slides, these kind of the hair fall pattern. Usually the male kind of baldness usually happens in if it will be ignored and it will be not noticed in the early phase of stages. These kind of facial hairs, or umbilical in the lower belly, you can see these kinds of facial hair pattern is there. So you should be careful. Even in the facial hair, these things are happening. Even in the darkening of the skin, that is called acanthosis, is this. Sometimes there is a excessive hyperpigmentation in your neck region, armpits, groin. So these things are there, then you have to be little more careful. So this is called acanthosis nigricans, skin condition that cause dark, thickened and velvety skin in body folds and creases, and it typically affects the armpits, groin and the neck, as I said. So these are the by slides I just wanted to show you. Sometimes even just with the lectures, people are not getting understand what's going on. By showing these, by seeing these pictures, you can correlate the things if something is going on like in your body. So you should visit to the gynec and get yourself tested and rule out the polycystic ovarian disease. Even with the acne, sometimes in usually nowadays polycystic ovarian diseases are very common in the adolescent age group. Adolescent is a group where the acne itself also happens. So usually the acne started, then girls are not bothering that family members used to say this can be the sign of your adolescent, so that's why it's happening. So the purpose of showing this slide is that, so there is a typical pattern of acne which is happening during a PCOD patient. It's not like your acne there is these kind of in your that angle of mouth jawline, and the pattern of acne will be like that. Even without other symptoms, if the acne is there, the pattern is like that, you should be little careful to get yourself tested for the PCOD. So, if I will go for the how. First of all, I just wanted to tell you why it's happening. As I said in my first in my previous slides, because of the lifestyle. Lifestyle is a one of a major factor nowadays. Although it can be the familial genetic things can happen, but the lifestyle is a major, because in the previous days also this disease was there, but it was not the incidence was not that high. But in last 5 to 10 years the incidence is gradually keeps on increasing and increasing because of the lifestyle, food habits and all. So the finally we can see this is more of the lifestyle disease rather than the genetic and other factors. So although the genetic factors are there, even the genetic factors are there, then also if you are aware about your condition, it can be prevented. That is a one of a thing. And the one good thing about that, if you are knowing about your PCOD situations, it can be well controlled even without a medication if it will be diagnosed in the early stage, but just by doing a lifestyle management, by doing the weight reduction if you are overside of weight, by doing the diet modification. So this can be totally controlled with just by the lifestyle management. So this much this is the one good thing about PCOD. So it's always the medicine is not required. It's in your hand. You can control the things, but definitely that should be diagnosed on time, and you should not go for the complication, should not face the complication of the problems. So if I will go for the PCOS diet, that should be simplified. I can say the no gluten, no dairy, stick to the food with the low glycemic index, load of vegetables, keep a close eye on your carbs, load up a protein, avoid processed foods, no added sugar. This is in nutshell we can say about you the diets, as you all need, because nowadays the all people are very much conscious about their diet and everything, and they used to take a help of the nutritionist. So this much they are knowing what are the things which I. So in nutshell, you have to know if you are a PCOD patient, you should avoid these kind of thing, and you should what you have to take. So you should know. So this is a typical picture of the two person. So this is typical PCOD kind of body. These, if you are going through these kind of body even without any symptoms, so you might get you are maybe going through the PCOD. You should get self tested. And even another picture which is showing again, it's not necessary if you are not these kind of figure and you are having this kind of model kind of figure, even if your cycles are irregular, then also you should get tested, because lean PCOD, not only the obese PCOD is happening, even the in a lean patient, although the cycle every body part is normal, there is no abnormal hair growth, body is also absolutely all right, but you are going through the periods irregularity or any kind of mood swings, so you should get tested. So this is a purpose of showing this slide. So both kind of person should be in your mind कि there is a chances of PCOD. If you are facing any kind of symptoms which was explained above, you should get tested and visit to your gynec. Now, another one worrying part of the PCOD is a hirsutism, that is abnormal hair growth. That is because of the hyperandrogenism, as I said, because of the male hormones, which is the imbalance of in a body. So there is a hirsutism, that coarse hair growth in androgen-dependent body areas such as the sideburn area, chin, upper lip, periareolar area, chest, lower abdominal, midline, and the thigh acne. Oily skin, abnormal menstrual cycles, and the infertility. These are the features which can happen just because of the hyperandrogenism, means excess of the male sex hormones in your body. So very like the another features which can happen, that is a clitoromegaly. If your clitoris can be the enlarged, deepening of the voice, coarsening of your voice, male pattern of balding, as I said, masculinization of your body habitus. Your body things will be like more like a masculinized type of body, increased libido. These are the things which can happen just because of the hormonal imbalance and the hyperandrogenism, less commonly seen than non-virilizing symptoms. These, although these symptoms are not very common, but it can happen. So these are the symptoms if you are going through. So you must consult your doctor. Diagnosis is usually made when you have any two of the following. If you are having going through the irregular, infrequent periods or no periods, that the menstrual irregularity can be happen in any form, either in form of irregular periods, infrequent periods, or sometimes people are not getting periods at all. So these kind of abnormalities you can face more facial or body hair than in usual for you, and or blood tests which show higher testosterone levels than normal. And ultrasound, if we will see, we can see the polycystic ovarian disease features of the polycystic, like and typical features in your that ovaries. The ovaries can be the more than the normal size. There can be the typical pattern of the necklace pattern that can be diagnosed by your radiologist. So if any of two features are there in your during your examination, that means you are going through the PCOD. So usually for the diagnosis, there is no single confirmatory test for the PCOS. It is a clinical diagnosis more of. That's why your clinical visit or the personal visit to the doctor is must. Ovarian cysts are not required for the diagnosis. It's not always necessary that your ultrasound will be suggestive of the PCOD. There can be the other symptom. If you have no finding in the ultrasound and the other two features are there, then you can be the PCOD. Cysts are present on ultrasound in more than 90% of women with PCOS, but also present up to the 25% of normal women. Here, I just wanted to emphasize one thing. Even if other features are not there, like another feature, as I said in my the previous slides, these things are not there, like in irregular menstruation, the facial hair, nothing is there. Only the only one feature is there incidentally, or while during your routine checkup you are diagnosed with the polycystic ovarian disease, PCOS finding in your ultrasound. That means it not necessary that you are going through the PCOD. That is a one of a thing which you should keep. Most of sometimes the people used to come, girls used to come in OPD and they said, "Yeah, I'm not. She's absolutely normal from the externally. There's no abnormal hair growth, no obesity. She is absolutely normal from the symptoms point of view." But while during her routine checkup, during the ultrasound, the finding was suggestive of the PCOD pattern of the ovary. So in that cases also, girls used to come back as the doctor, I should take some treatment. So I just wanted to emphasize here, if there is a just incidental finding of your in your ultrasound there is a PCOD and there is no other features available, so it's not like you are a PCOD patient. So here again I want to emphasize, for a PC to diagnose the PCOD, two things should be always there, either in the finding of the ultrasound or the biochemical, and that things are. But apart from that, sometimes even with all the normal features, now we wanted to see the patient physically or do the examination, because the few things which are really an indicator, and that gives the clinically, that gives the finding of you are a PCOD patient, and we used to keep watch on that particular patient, or even if there is no previous history or no complaint of any other PCOD features. PCOS endocrine abnormalities on laboratory tests. What are the tests which you usually used to suggest a patient? So you used to see if the somebody is a PCOD patient who is on today's live show. So if you will go to the doctor, they usually give you the set of hormone investigation. What is the purpose of doing that investigation? So most of the time, we just wanted to see where you are at present, what is the hormonal changes or hormonal level is going inside. For in that hormonal level, the few sets of hormone which is responsible for the normal ovarian function, that is called LH, FSH, prolactin. As I am discussing since now, the testosterone, that is a hormone which is present in all females, but their level used to get disturbed because of they are the main culprit of the disease. So definitely we would like to see the what is the testosterone level. So these are the things which usually we used to do. Apart from that, the blood sugar we used to see. Sometimes we are simply just advising a fasting and the postprandial blood sugar. Sometimes we just wanted to see that there is any insulin resistance in a body. For that, we used to just advise a patient for the insulin level. But nowadays we are preferably doing the blood sugar fasting and PP, even if the fasting and the postprandial level are normal, and we are suspecting clinically the patient can go later in later part of life, she might face of the PCOD. So in that particular patient, we used to advise the patient for the OGTT, where we used to give the load of glucose and then see how the body reacts. So these are the few things which we are doing. That is the importance of visiting a clinic to see how the things so in individual patient we can assess which patient, even if the normal level, she might be there is a history which is suggestive of she might land up with a PCOD in later part of life, or some clinical finding which can give a clue of she might get. So we used to keep watch and we ask a patient how she should take care and how she should monitor the things so she should not land up for the PCOD. So for that reason, the clinical visit is must, as although you all are knowing the features and everything, but still the clinical examination is must for these things. So basically what these are the suggested laboratory evaluation which we are doing for the PCOS, as I said: prolactin level, testosterone level, LH and FSH, thyroid level. Now again, the thing is why we are doing the thyroid, because thyroid is a one of a hormone, and even thyroid disease can also mimic like a similar kind of things like a PCO. Sometimes the patient is not having PCOD, but she is a hypothyroidism patient. In hypothyroidism also you will have a weight gain, you will have the hair loss, you might face abnormal hair growth, you will have the menstrual irregularities. So thyroid level is also must. We should not jump directly for the PCOD. We should also know the other reasons of these features which is responsible for the anovulatory cycle, the fasting glucose level or 2-hour OGTT, as I was explaining you. Lipid profile. Why lipid profile? Because indirectly the this hormonal system get affects on your other parts of the body, other organs of body like a liver and all, which ultimately causes the abnormality in the lipid and all. So that's why these are the things which is important. So these things are important, and another cause, as I said, the what are the other features, the intermediate and long term consequences associated with PCOS. This is also very important, because most of the time the patient, as I said, the importance of this knowing the disease is that as early as it will be diagnosed, it will be curable, and with the just normally with the just lifestyle management, even if the medicine will be not required for these patients. So that's why the early diagnosis is very important in PCOD. What are the, if it will be ignored, what can be the happen? You can see in this slide: infertility, recurrent spontaneous abortions, depression, anxiety. Dyslipidemia means your lipid profile can be get disturbed in manner of total cholesterol will be elevated LDL. So these are the levels which can be disturbed because of your PCOD. Hypertension, you might go through hypertension in the later part of life. It will be not diagnosed. If it will be not diagnosed in early stage, you can land up with the diabetes type 2, diabetes mellitus type 2 means the diabetes which used to happen and because of the endocrinal disturbances. Coronary atherosclerosis might lead to the heart problem, cerebrovascular accident because of the hypertension. And the worst thing is endometrial carcinoma, because if your cycle, you are not getting your cycle, there is a chances of the hormonal disturbance, and your endometrium will be keeps on forming, and there is a hyperplasia of the endometrium. And if it will be neglected, be more prone for the endometrial carcinoma. So these are the consequences which can happen if it will be untreated, unsupervised, undiagnosed. That's why the diagnosis is must, and if you are diagnosed, the proper treatment is very much important. So you should know, okay, what are the consequences which can happen with the simple PCOD, which is curable in early, if it will be diagnosed in early stage even without a medication. So it's a clinical syndromes associated with insulin resistance, the type 2 diabetes, cardiovascular disease, essential hypertension, polycystic ovarian syndrome, non-alcoholic fatty liver disease, certain forms of cancer. So that's why the terminology is, if you will go on net and Google the things, you will find somewhere it's a polycystic ovarian disease and somewhere it's a polycystic ovarian syndrome. So why it is called, previously it was called a polycystic ovarian syndrome because it includes a multiple organs of a body and it causes multiple problems. That's why it's called as a syndrome. And but if it's only affecting your hormonal system, then it is a polycystic ovarian disease. So with the before if it will be diagnosed in the early stage, so as a disease state, so we will not land up with all the syndromes and things like whatever the things is you are seeing on a slide, the diabetes, cardiovascular disease, hypertension, non-alcoholic fatty liver disease, sleep apnea. These are the complications which can happen, and these all are avoidable complication if it will be diagnosed in early stage. So now you can see the what are the there is a emotional effects of PCOD, which is very important nowadays. The people used to come with the lots of mood swings and the anxiety, depression, and if you will not believe, these symptoms are very common nowadays, and this can be one of a feature of a PCOD. So you should know, if you are going through all the features, although your other things are absolutely normal, but still you have to get tested, checked, and examined by a gynec to know that you are not going through the PCOD. So these are the emotional effects. Embarrassed about the appearance. Why it's happening? Because of the appearance, because you are gaining weight. Anxiety is another features which keeps on happening, although you wanted to try to avoid it, but still you feel always anxious. Concerns about your future conceptions, because if even if you are knowing that you are PCOD and you are trying to, but still there can be the emotional effects can happen because of your, you are knowing there is a chances of having infertility, the future conceptions. So these causes a problem, and ultimately you are depressed, and that affects your problem. It's a kind of a vicious cycle. The more in these symptoms happens because of your problem, and because of all these symptoms you will get more disturbed, so ultimately you will go in a depression. So that cycle should be that taken care beforehand to go in that particular vicious cycle. So PCOS consequences, insulin resistance up to 75%, evaluate for the hypertension, as I said, metabolic syndrome, and the endometrial hyperplasia. These are the consequences, which is really a bad consequences of the PCOS. So chronic anovulation causes, as I said in your previous part only, why it's happening, because of the chronic anovulation, periods not happening, and the endometrial hyperplasia, and that can cause the endometrial cancer. This is likely due to the prolonged exposure to the unopposed estrogen. These are the things which is happening. So three times then the, if you will compare the risk from the other non PCOD patient, if the patient is a PCOD, she is more prone for the endometrial cancer. So that's why they should be in a proper checkup or routine checkup for their, even if the things are under control, that girl should go routine checkup for their all the body hormones, as well as the ultrasound to be done. Even with the family is completed everything, if that she has a history of PCOD, she should go for the routine checkup, she should go for the routine ultrasound, and as a preventive health checkup to know what is their status, because they are three times more prone for the general population to get the endometrial CA. So they should be little more careful regarding their checkup and the prevention. So dyslipidemia, obesity, as I said, the 60 to 80% of women with PCOS are obese. It is predominantly of the android type with increased hip and waist ratio. If you will see, there is a typical pattern of the obesity in that PCOD patient. Their body used to be more of the pear-shaped body. So the hip ratio used to be increasing, keeps on increasing, and they are not irrespective of their diet. So this happens because of the hormonal disbalance, as I said, and that can be, if these things are going through, you have to be careful, you have to get tested. What are the complications happen because of the PCOS? Impaired glucose tolerance. As I said, type 2 diabetes, you are more prone for the type 2 diabetes if you are a PCOD patient. Up to 40% of women with PCOS have an impaired glucose tolerance test. Risk of IGT and type 2 diabetes mellitus is more in obese and non-obese with PCOD. Retrospective studies have shown 2 to 5-fold increase of type 2 diabetes in women with PCOD. So since very first slide, I am telling repeatedly the lifestyle modification, the physical activity is one of a key management and the treatment of the PCOD, which is totally under your control. So if you are aware about your situation, you have to maintain your healthy lifestyle. You have to do a work, regular exercises, diet modification. So if then again, first of all, what every time you will go to the gynec, they used to say weight loss, and that is not that easy to say. So usually for the PCOD patient, the weight loss is not easy process, but you should keep in a mind, even the 5% of your body weight reduction is happening, it is very very helpful for your the PCOD situation, and it used to take care the whole that hormonal system. So weight loss is not necessary. If you are a 60 kg, you have to come on 40 kg. It's not necessary. It depends how is your BMI, and what is your actual body, what should be your actual body weight, that you should not reach there. The one, if you are, suppose you are obese and you are gaining weight, and you are only the 5 to 10% of you are able to manage your 5 to 10% of weight reduction, that is also more than enough for the PCOD. That is very very important point I just wanted to emphasize, because most of the time the PCOD obese patient used to come, and we used to advise a patient for the weight reduction, and they used to get very frustrated कि I'm not able to reduce my weight even doing all my diets and all the exercise. But you should not feel bad, you should not be disappointed with this. Gradually you can reduce the weight, but if you are able to just reduce your 5 to 10%, that is also very very helpful for the PCOD patient, and you have to maintain that thing, and later the gradually the things will be control. Once the hormonal pattern of your body will be under control, the gradually it will be helpful for your weight reduction also, and you will able to achieve your goal later part. So in initial days, your goal should be only to reduce 5 to 10%, not more than that. And even with that, if it will be sustained, it will be good for you to maintain the later part of your weight reduction and in a normal hormonal system. So, first line of treatment is a weight loss. As I said, changing in body weight have been associated with improved ovulation. The pregnancy rate, weight loss, little as 5%. As I said, initial weight has shown weight loss shown a beneficial role on the PCOD. And decrease the carbohydrate and fat intake, added sugars, juices, soda, chocolates. These are the small things which you can do during your diet modification. So eat more of whole grains, fruits, not the juices. So simply, if the people are thinking they are taking a healthy food, they are including fruit juices in their diet. And I just wanted to emphasize here, if even if you are trying to even if you are trying to lose a weight, and you are not taking a carbs, and you are taking a juices every day in different in your whole day meal in multiple times, that is not good at all. So basic purpose is you have to balance your diet with the whole grains, fruits, and veggies. The all things should be there. The most important thing is during your diet is timing your diet is also very very important. If your diet timings are erratic, it will be a very difficult to control your hormonal system. So that's why the timing of diet, in the diet between duration between your two diet, interval between your two diet is also very important. So these are the few small things which you have to aware. Sometimes the people are doing, they are trying their best, they are just avoiding diet and all, they are skipping their breakfast. So these things are not acceptable at all in, if you are a patient of a PCOD patient. So your things is not to just cut short your diet, the thing is to regularize and modify your diet, not to do a diet. So now coming to the treatment of acne and hirsutism, usually for the acne patient, if the somebody is going through the PCOD and they are facing lots of acne and the lots of hair growth in their body, so in initial days we used to give the medication to control the things, but still we ask a patient to do the lifestyle management, because that is the only key thing which will be helpful for the longer time. Because initial days, by giving external hormones, we can keep the things under control, but the moment we will leave it, again the things will be same. So that should not be happen. But if still the patient is going through the lots of symptoms, we in initial days we used to start with the oral contraceptive pills, and that used to be helpful, especially the person who is not keen for the pregnancy. In that person, we used to combine oral contraceptive pills. So that is a very very helpful things. And again, here the myth about the contraception is that it should not be taken, especially the patient is unmarried, so you should not take it. So it's totally wrong. It's totally, the fact is, see, ideally if you are a unmarried girl, so you should, rather than going with the other hormone things and other treatment part, it's always better to go for the oral contraception combined pills, which gives in a small amount of hormone, slow releasing hormone in your body, which will take care of your worsening, just stop the worsening of your disease, and simultaneously it will just take care of your all the symptoms related with the acne or hair and hair growth, in abnormal hair growths. So these are the things which to be kept in a mind. So simultaneously, if the patients have the more of a symptom of the hirsutism and all, so all the we used to start the treatment part. If it is required for the hirsutism, we used to start the treatment, and we just try to just normalize your hormonal profile. By the meantime, we ask a patient to, you can go for the all the mechanical things by saving or and that electrolysis, laser removal, 30 to 50% of reduction at 6 months after multiple session can be possible. So whatever the hair growth happens, that will be not goes off with your treatment or your lifestyle management, that will be taken care mechanically by all these manual, all the modalities which is available in market. So these are the things you have to keep in a mind. So it will be not vanish, but definitely the further hair growth will be not happen. So this treatment, whatever the mechanical treatment you are taking, that will be helpful if you are taking both things simultaneously. So if the hirsutism is a thing, we used to give a treatment as a, I just wanted to just don't want to discuss all these slides with you, because these are the drugs which is not applicable for all. So only you should know once the things are not under control, and it will be it used to customize from person to person. So all the PCOD is not, it's necessary to give all the medicine or not to give medicine or to take. It depends upon what kind of symptoms, what kind of demand. Like some patients are keen for a pregnancy, for that the set of treatment is different. Some patients are not keen of a pregnancy, their concern is only the symptoms like hair growth or acne. For them the symptom treatment is totally different. That's why I just skip my slide. I just wanted to say that for the person to person, it's the totally the customized thing according to them, and who requires what, accordingly we used to give the medicine or the treatment or the lifestyle management. That is totally from individual person. But these are the few things which can happen. The oligomenorrhea or amenorrhea treatment, for that we used to give the weight loss treatment. Ocipils we are prescribing, we are giving the metformin, insulin sensitizing agent. All treatment options have a prevent the development of the endometrial hyperplasia. So it will definitely just prevent the long term sequelae or the complications of the PCOD. So these are the benefits of OCPs: regular withdrawal, bleeding, reduction in the risk of endometrial hyperplasia and cancer, reduction in the LH secretion, which ultimately causes the consequent reduction of ovarian androgen, increased sex hormones, improve binding globulin production, and consequent free testosterone reduction, which is the main culprit of the PCOD. So these are the how the OCP acts. And as I said, the myths regarding the OCP, that should be removed totally from your mind. That is not that bad. So it is ideally you should take, if you are going through the adolescent PCOD, or some young girl is going through the PCOD, they should go for the treatment rather than going for the worsening of the disease and coming late. Usually girls are coming late why once they are planning for a family, then they are not getting pregnant, then they used to come for the PCOD, and then they used to diagnose during that time they used to diagnose during the PCOD, then it used to be a little late for that individual. So that's why the today's presentation was, you have to be, when you have to visit your doctor, that is very very important in PCOD, and to just prevent the PCOD. Cyclic progesterone, these are the few things which is I just wanted to skip, as I said that these are totally the customized things from individual patients. So treatment of infertility is again a thing which is a long thing, which is not required from your point of view right now, because again it depends what kind of infertility problem she is going through. It's just because of the PCOD related or other problems are, it all depends, and accordingly we used to choose the things. But definitely here I just wanted to emphasize one thing: insulin resistant is a basic root cause of a PCOD, and for this it's not always the treatment is required. So initial days, if it will be diagnosed in early, even if diagnosed late, and you are able to maintain your lifestyle management, like lifestyle modification, you are able to do it. Weight loss, you are able to do it. Increase your physical activity, exercises, insulin sensitizer medication sometimes is not required in all cases. Even if you are going through the insulin resistance, your blood or parameters are suggestive of the insulin resistant, but still we used to wait and watch, and the results are really really very good, and it's a long lasting result. So here the just wanted to emphasize one thing, ki if you are going through the simply insulin resistance and there is a symptoms which is related with the insulin resistance are there, in that person we are not directly giving the medicine, but definitely if your the other parameters are also disturbed and we feel like there is a chances because of the insulin resistant these things are getting and it will take time. So in some patient we used to start the insulin sensitizing medicine, simultaneously we ask the patient to go for the lifestyle management, and gradually we used to taper the medicine and we just off the medicine and continue the lifestyle modifications. This is how we used to proceed for these kind of patients. So it's not necessary it will be given in all patients, or it can be given, it will be not given to anyone. So it all depends how your features is and what is the other features are suggestive of. Accordingly we used to advise a patient to the treatment. So, women who desire contraception means they don't want to get pregnant. So, we usually in that patient we used to prefer giving a oral combined OC pills. As I said, the OCP is the best thing which we can give if the patient's concern is only obesity and cycle is regular. Then we used to just ask for the lifestyle modification. If the insulin resistance are there, and apart from insulin resistant there are other features which is suggestive of other oligomenorrhea and other clinical features are there, in that particular we used to start sometime insulin sensitizing agents, as I said. So basically these are the all things which is very very uh, customize things, as I'm telling you repeatedly, for the person to person. But one thing from your side which can be done is the lifestyle management. In lifestyle management, not only the weight reduction or exercise important, the sleep is another important thing for your lifestyle, which is very very much lacking during the new generation. And because of the lifestyle problem or our job profile, whatever is the factor is, but the sleep is one of the most important thing, which is required to regulate your hormonal system. So minimum 7 hours of a sleep, good sleep is very very important. Although you are doing exercises, you are doing your taking a help of your nutritionist, you are doing everything, but still if you are not able to manage your things as and not able to manage your sleep, so then it will be not helpful at all for the hormonal system. So good sleep, good diet, daily exercise, these are the basic key for the your basic key for your lifestyle management, which should be known to all. So that's what I just wanted to give you a message. Hope you all will be benefited, and you will know when and how and at what condition you should go to the get yourself tested and checked by the gynec. And so that is the basic purpose of taking today's session is, although everybody is aware about this terminology, but still they should know what is importance of the different clinical feature and when they should go to the doctor and they should meet. And even without the menstrual irregularities, you can land up with the PCOD. These are the few eye-opening things which I wanted to tell. So you should visit your doctor, and if you are diagnosed with a PCOD, you should not get depressed at all, because this is the one thing which can be taken care even without a medication, and it's totally under your control. So that's what I just wanted to convey a message to this, all of you. So hope you will be benefited with this lecture.